Hello everybody, my name is Dr. Aaron Marks. I'm from Smiles and Matthews in Matthews, Virginia. Today I'm going to be answering some questions about Botox and its use in dentistry. So Botox is regulated by each state, so each state is different as far as who can and can't do it. Recently, Botox was approved to be done by dentists for aesthetic reasons in Virginia. Before that, you could do it for therapeutic reasons. So I mainly use Botox, one for aesthetics, but mainly therapeutically for either headaches or TMJ, clicking in the joint, tired jaw, things of that nature. So Botox at its base works as a muscle relaxant, very localized, obviously. It is a toxin, but it's at a very low dosage where it is one of the safest drugs in existence. Someone that hasn't been trained, I wouldn't go to them, obviously, because it can do reversible harm. Mainly the biggest risk you run is having some type of paralysis. Again, it is temporary, usually lasts about 3 months, but it's very safe. So in cosmetic dentistry, we can use Botox to help with high smile lines. So if you show a lot of gums and you don't like that, we can use that to weaken the muscles that bring the lip up really far. Around that, we can reduce any wrinkles that are around the mouth, obviously crow's feet, all of that. That's aesthetic concerns. I do not know the exact qualifications that a med spa is going to have, but I do know there are side effects that they are not as trained as well. Dentists are heavily trained in our head and neck anatomy. We know exactly where all the muscles are and where and what to do and what not to do. We're going to have a better area of being sterile in our administration because we are regulated so high as far as that goes for obvious reasons. In med spas, they don't have as much regulation. Actually, come to think of it, they don't have much, if any, regulation because that's why they're so popular. So Botox does reverse because your body burns it up, and it generally lasts about 3 months. So Botox appointment at the dentist, depending on why you're there, if you're for aesthetic or therapeutic. So if you're there for aesthetic or therapeutic reasons, it's pretty much the same, but we're just going to be targeting different muscles as far as where we're going to be putting the Botox. Usually we'll do some mapping of the face, so we might put marks directly on the face so we keep track of where everything is. Obviously those are removed once we do it. You're going to want to not have any makeup or hair products, no active infections on the skin at that time or rashes. And then afterwards, you're not going to be able to wash your face or touch it at all because if you move the Botox around, because it is injected as a solution, if you move it into the wrong spot, it could affect muscles that we're not trying to affect. So again, therapeutically, I use Botox to reduce the amount of force you can create while biting. So if you're a heavy grinder, what we call a bruxism, or if you are someone that has needed a night guard or do need a night guard, that is in conjunction with the Botox to help reduce the stress on all the muscles and in return reducing the stress that is done on your skeleton basically and all the joints and ligaments. And if you're creating a whole lot of stress with your muscles, if we reduce that force, everything's better. If a dentist is offering it, you know that they've been trained, more than likely, unless they're doing it without training, which maybe confirm that. Just wonder or ask where they were trained, how long they've been doing it. Again, it's pretty safe, but if they do it in the wrong spot, it can cause temporary drooping of the face. That's the main risk.